recording and let me hide the results of the poll and switch over to share my screen. So what I'm going to ask you, yes, some of you have already done this before the session even started, is really to type into the chat window the city and country where you are connecting from. And I'm hoping you can all see my, let me see, that you can all see my screen. And if you do, then you should see week 2 discussion group with today's date. Okay, so we have Nigeria. We'd like to know where in Nigeria, Tosin. Seattle, USA, Lahore, Pakistan, Douala, Cameroon, Nairobi, Kenya, Jigjiga, Ethiopia, Sur Oman, Delta State, Nigeria. Thanks, Tosin. Jama, Somalia, Mongolia, Esau in the Gambia. All right, Manila, Philippines, Budva, Montenegro, India. This is always an amazing moment in the course to see this many, people from this many places all connected together. So, all right, let's get started. So, ground rules are right here. You've seen these before, and you will see them again. Just to clarify that we did send out a call. I believe it was on Tuesday or early Wednesday, for people to submit questions for Dr. Rudy Eggers, who's kindly joined us for this session, and a call for volunteers to present in a comment and we only consider the submissions the expressions of interest that were submitted in a comment on the update in which we issued this call. So I hope that those of you who, some of you shared through WhatsApp, through various channels, we can only take expressions of interest in this specific way. Otherwise, it gets very complicated to manage, and I hope you'll understand that. Now, I'm also going to ask you to help your peers, because I see that Pascal, Pranit, Ranjitesh, even Paul are disconnected from the audio. So if some of you could private message them, or just because they can't hear us, if you could help them get connected to the audio, that would be much appreciated. All right, so the agenda will be, so we'll go through, we'll review your feedback, the feedback that you gave us about week 1. We'll give you again an overview of the schedule, a quick reminder of what's next, what your deadlines are. And then we'll look at questions submitted by participants, and then the bulk of the session will be dedicated to oral presentations by participants and discussion. Dr. Rudy Eggers will be asked to give his feedback and share his insights and experience and expertise in response to these presentations. During the Q&A, of course, we'll have him and the rest of the course team, subject matter experts, Jill Milbell and Alexander Kurik, answer your questions as well. So that is the plan for this session. This is very dynamic. This is about your participation. There is no lecture in this session. In fact, most of you should have seen the 2-part slide presentation by Dr. Rudy Eggers about an introduction to the GRISP. So hopefully we have already a common language, and you've already spent a considerable amount of time going through the guidelines. Now, I did want to say, because we've been asking you to give and receive feedback in the community, in the updates that you initially made about the country, your country of focus, we did get this feedback. I hope that there will be improvement in some colleagues' interactions when they receive a suggestion. So I thought this would be the occasion to actually remind you of the principles we've set up for non-judgmental collaboration. So basically treating people in the community when you're responding to someone the way you would want to be treated, or even the way they want to be treated, should be your basic guiding principle. And we're also very impressed by the level of interaction and by the depth of the suggestions and insights that you've shared, but did want to share this piece of feedback and our position on that as well. So week 1, this was the assignment. 63 of you posted updates, and this is the list of names. If you do not see your name on this list, let us know. But these are the individuals who posted by the deadline, of course. Now, to give you a sense now of what the countries of focus are, this is actually the countries of focus from 2016. So you could see that Tanzania, Nigeria, India, and the Gambia were the main countries of focus in that course. Yes, so for Mohammed, who says he posted the update, but his name is not there, just send us an email, or you'll find the list in the community. We're going to post it, and you can add yourself there along with a link to your update. And now, by contrast, here you can see a very different picture with the selected countries of focus. Again, in 2016, you had 41 countries, and this year we have 63. So with a larger group starting out. So these are the countries that you're most likely going to be working on in your creator project. This right now is just for the updates. Again, in 2016, these were the transformative investments that that were selected by participants. And in 2017, strategies to reach is again the top choice. Let me try to, yeah. So that is information to give you a sense of where your colleagues are at in this course. You know where you fit into this, of course. And then there are just others in the course, so this will give you some idea about that. And Noor Ali Mohammed, thank you for sharing that link to download the actual slide presentation. You'll find all the useful links in the materials panel, so do look at that. It's in the where it says go to training control panel. You have dashboard, activity, audio, chat, and you also have an item called materials. So look there to find the presentation, but you can just use the link shared by Noor Ali. And again, definitely encourage you to share resources together. So week 2 update instructions. For week 2, what you're doing this week, and some of you have already done it, again, is to scan the updates to identify 3 updates that list strategies in which you have professional experience. And then you're going to want to add a comment for each of these updates. And really, this is not about judging or criticizing your colleagues' updates. On the contrary, it's about sharing your experience of a specific strategy that they have prioritized, and then to suggest activities that are relevant. But the point of suggesting it, if you suggest an activity, it is because you have either evidence or experience or both as to why you think this activity will work. And keep in mind, you might be looking at updates from a colleague who is in a completely different country context that you may or may not be familiar with. So really, this is about giving feedback, and then of course for the authors of the updates, receiving feedback. You'll be doing this same giving and receiving feedback in the structured peer review that will be coming in weeks 4 and 5 of the course. All right. So great. The week 1 feedback, as of this morning, we only had 19 people respond out of almost 100. So that was a bit disappointing. And I do want to say we need you to tell us how the course is going for you, even if you're really behind or if you're on top of things or somewhere in between. Your feedback is the only way we have of knowing how we are doing. We'll be giving you feedback about your work in the course, but and so with respect to difficulty, obviously the first week of the course, this is what you told us. So 1 is very easy, and you can see a preponderance of you have found the difficulty very low, very light in the course, and that's heartening. Week 1 is just getting started, getting comfortable, and that's just so we're pleased to see this result. The yeah, so Helen Nwanosike says that she had great feedback on her week 1 update from Alain Blaise, plus a helpful link. All right. Alex Ajagba says, where do we find the questionnaire for week 1? You will find it in the materials panel. So if someone would like to post that for Alex, that would be much appreciated. So relevance, this is what you told us. And the little graph is the 2016 answers to the same question. I think we had 26 responses there. So so again, the relevance, the usefulness of preparing that week 1 update in terms of helping you think about the GRISP transformative investments in your country context. That's ultimately what we are interested in. Your level of motivation, and similar to last year, this is a highly motivated group. And you did tell us specific things about your motivation, such as, I'm very glad to be part of this course. I'd like to thank the GRISP team. There's the hope that there will be more chances to participate in future courses like this one to build my capacity. So, are you receiving the support you need in the course? And we've been working as hard as we can to make sure everyone is on board. It does require an effort from your part as well, though. And you know, so many of you have put in that effort. There's no doubt about it. In terms of support, there was some appreciation, but there are also some problems that we cannot solve, such as connectivity. And we have many strategies we can share if you know that you're going to be having poor connectivity or bandwidth or intermittent access issues. We used to share those systematically. We now share them on request because most people already have their own strategies for working when they're in a less than ideal bandwidth environment. Now this one is interesting. Most of you are finding that the time that you've dedicated to the course is less than what you expected or just right, and still a significant portion of you have spent more time than you expected. Now we did get some really good, I thought, constructive suggestions, such as kindly consider having a course book in PDF format for participants to use along with the course. And we already have that, which is that the learning module for the course is something that you can save as a PDF, you can print or save as a PDF, and then it's virtually, so like a course book that you can really use for self-study or for review or for catching up. We also have the catch-up guides, which are single-page summaries of all of your tasks and deliverables for a specific week. So yeah, ensuring that all people join are registered. We've certainly been trying to do that, and we've got nearly everyone on board with this higher proportion than we did last year. Now, to give you a sense of where we are in the week of 23rd of October. And here you can see what you should be doing in Creator, what you should be doing in the community, the skills that you'll need to use Scholar correctly in this in this week. And of course, the big news this week is that you are starting on your Creator project. And really, my advice to you is, if you want to make it all the way through this course, do not wait until the final days of week 4 to start working on your Creator project. It will be very difficult to do the kind of intensive thinking, data, sort of data gathering, preparation, writing, drafting, reviewing, revising that you need to have done in order to submit a draft project that your colleagues will then peer review. Having said that, yes, it is a draft project that you are going to put together. You will have the final week of the course to use the feedback and inputs you've received from your colleagues to actually finalize your work and make it as close to perfect as you are able to with the time that you have allotted to the course. So next week is actually the first big deadline, which will be the 3rd of November, which will be to submit your project draft for peer review. So that is coming up very quickly. Do not underestimate how fast time flies as you begin to work on your Creator project. And of course, as usual, the other piece of advice I can share is look at the tutorial videos. There are some steps you have to take that are not intuitive, and you have to do them in a specific way, and those instructions are found in the video tutorials. If you are unable to stream YouTube, those videos are available in the course resources folder. All right. So that's it for the recap of what we're doing up to week 2, as well as your feedback on week 1. Again, we thank the participants who've completed the feedback questionnaire. That is always much appreciated. And now, very pleased to introduce Rudy Eggers, the principal author of the GRISP guidelines. These are, again, the ground rules for the Q&A. Rudy, welcome.
Hello, yes, can you hear me?
Yes, loud and clear.
Wonderful.
Welcome, and can you
Thanks
tell
a
us
lot.
where you're connecting from and how you are doing this afternoon, if it is afternoon for you?
Okay. Yes, so I'm connecting from Nairobi, Kenya. I see that some of the other participants are here in Kenya or in Somalia or in the vicinity, so very much in line with that. I've been out of the immunization program for a year now, so it's a little bit looking back into an old program that I was involved in, but very pleased to be with you here. Thanks.
Great. Thank you. All right, so we have 3 participants who submitted questions ahead of this session, and again, that is the best way to do it. We will have, if time allows it, we may have room for additional questions at the end of the session, but really we'd like to focus on the people who made the effort of preparing written questions and submitting them ahead of time. So, and of course, I'd like to invite Jilmil Bal and Alexandra Karik from the course team to pitch in as well. But we really wanted to use this time for participants to engage directly with the original author of the guidelines. So the first question is from Tapas Nair, who says, I have a question related to something I read in the GRISP documents, and a very specific page reference to strategy number 3 on page 58. And a question about data validation of administrative data. And yeah, I see that Tapas is online, so I'm going to unmute them. And welcome. Are you able to speak to us? And if so, could you summarize your question briefly, please?
Hello, everyone. Am I audible?
Loud and clear.
Okay, so my doubt was when we do data validation, when we compare the data of administrative data with evaluated data, at the national level we can do data triangulation, but at the subnational levels, like maybe states and provinces and districts, the EPI managers are not trained in data triangulation. So at what sort of analysis do we expect them to do? Do we just like sort of compare the data and see that, okay, as per administrative data, my province is showing 86%, but my coverage data is showing 60%, so I need to cross-check the quality of my administrative data, or are you expecting them to do something more? That is my question.
Reda, should I go ahead?
Yes, please.
Okay. Well, thank you for the question. So GRISP as a whole actually is very much targeted at the national level of the program. So while of course these strategies are applicable at lower levels, the initial attempt of the GRISP was really to strengthen the national level. So I take your point very clearly that triangulation of survey data with administrative data at local level is really difficult, and that's in addition to just the difficulty of bringing the exact numbers together. We know, of course, that surveys are, the smaller the sample, the less reliable they are. So in fact, a survey of a very small area, if taken out of a bigger survey, is much less accurate actually. So in fact, doing data triangulation at a very small level using a big coverage survey is quite problematic. So what was really meant here is to use the survey data at higher levels, be it at a provincial level, at a national level. Some countries have got regions. So at that level and at national level, using surveys to actually make sure that you understand your administrative data better. So what does the survey tell you about your administrative data? Is there a way that it can lead you to improve the collection of admin data? Because ultimately that should be your aim. Your aim should be that the admin data is of such high quality that you in fact are very, that you trust it, that you rely on it. It is of good quality. So that is where we're trying to go. So the other example maybe I would like to use is, well, let me just step back. So the purpose here is not triangulation in the accurate number sense. The purpose here is to inform the program rather than the exact number. You're trying to query the administrative data in such a manner that you can direct the program using the survey data available. I don't know how many of you are familiar with the WHO coverage estimation process. So on an annual basis, WHO goes through a process of estimating the coverage of every country, of every antigen every year. And what they do there is really they put together all the information, all the data that they have together on coverage. The most basic is, of course, the administrative routine coverage that is reported by the country. To that, they add the survey data, but they even add other information. So there might be vaccine supply information, there might be knowledge about stockouts and those kind of things that they bring to bear. And from that, they come up with a best estimate. What is the best outcome of what the data is that you have in front of you? And that is really what is meant by the strategy, is using the coverage surveys to query your admin data so that at the end you are more trustworthy of it. Let me stop there. Thanks.
Yep. Thank you, Rudy. All right, let's go to the next question. This is from Mohammed Miro Salem, and Mohammed, you will need to unmute yourself. If you could tell us what you had in mind with this question, which we can see up on the screen. You need to, yes, welcome.
Yeah, thank you very much. Can you hear me, please?
Loud and clear.
Thank you so much. Regarding the GRISP document, page 33, 4.1.5, they say that the creating synergy among routine immunization, accelerated disease control efforts, and new vaccine introduction activities. Large-scale vaccination campaigns have the ability to reach far beyond regular health services. Those using house-to-house vaccination or conversing strategies offer an opportunity to review the vaccination status for all children encountered and to refer them for any needed doses. Additionally, through careful planning, campaign activities, and the potential strengthen routine immunization plans. My question was, if we take the household campaign like polio SIAs in Pakistan, there are few constraints, like team members are working in areas where no female volunteer available, or the areas where the volunteers with only limited knowledge regarding SIAs, they don't know how to assess the routine immunization. They are only trained for a couple of days to commence the campaign, how to deliver the 2 drops of polio to the children. And due to the human resource issues in Pakistan, like areas like Rahimir Khan, there's a district in Punjab, tribal areas in DI Khan, DG Khan, also the Pata areas. Where there is a problem of human resource and there is continuous shuffling of people. So how can we do this kind of thing, that people who are working as polio member, they guide them for routine immunization vaccination at kid station or at the outreach session generated by a vaccinator in the field?
Yep, you're breaking up, Dr. Mohammed, at least for some of us. Rudy, over to you. I believe, fortunately, we have the question in writing, so Rudy should be able to address it. Go ahead, please.
Yes, thank you again for that question. Am I clear? Can you hear me?
Yeah. If you could type OK in the chat, if you can hear Dr. Eggers. All right.
Okay, wonderful. Okay, so again, the strategy in front of you here, the key word in this strategy is using opportunity. Basically, if you think about it, those that energy that we put into something like a house-to-house polio campaign, that energy can be harnessed to actually support routine immunization. So we know that the polio campaigns will go ahead in any case. People will be trained, people will go out, they will go to the furthest reaches, they will actually go far beyond where the routine program can reach. And the purpose of this strategy is to make you remember that the energy that you've got in reaching these outlying areas should be harnessed for routine immunization. So basically, you make the statement such as you have volunteers with little knowledge about SIAs or little knowledge about routine immunization, but know only about SIAs. They've been trained only in SIAs. Well, this to me is an opportunity for the routine immunization to actually make sure that the volunteers are indeed trained for routine immunization and not only for the SIAs, so that they are able to review the cards of the children that they meet, to advise the mothers on when the child should go for the next vaccination, and to prompt them to get missing doses delivered. So what the strategy is asking for here is really, if you make the effort of going out and doing a polio campaign, why not make the little extra effort of training those volunteers with the knowledge? It's basically 5 or 6 sentences that you need to teach these people so that they know how to look at a card and how to respond to it, and use that opportunity for the routine program. The whole key about this strategy is using the huge opportunity of a campaign for the routine program. Issues such as difficulty of access because lack of female volunteers. In Pakistan, you gave the example. This is, of course, a bigger problem. So if you have lack of access due to the wrong vaccinator, then, of course, it is even the polio campaign that is not being properly done, because if the vaccinator can't access the child because it's not a female, you've lost the opportunity. So that is actually a bigger problem that needs to be addressed at the higher level. Back to you.
Thank you. Thank you, Rudy. I see some interesting comments in the chat. So from Friday and Coma, thank you, Rudy. I appreciate your answer, and thanks to Nair for bringing this up. So this is about the first question. It is a huge challenge to have accurate data for immunization, even here in Zambia. Rizwana Memon mentions mobile vaccination teams by outreach sessions. And then Mohammed Miraz Salim, yes, as a PEI, EPI synergy coordinator, we're planning on it in Pakistan, also by sparing vaccinators from polio SIAs as well. And then Khalid Abubakar Aiza, in line with Mohammed Miraz, the SIA's team are used to strengthen surveillance during a campaign. Mohammed Kulu Farah asks a question to another participant. Mohammed Sheikh, could you define for me hard to reach areas? Tapas Nair says, I am unable to download the GRISP learning module from the materials section of the GoTo training control panel. Chances are you're trying to do this from a mobile device. You do need a desktop browser, or you can put mobile Chrome in desktop mode in order to view the learning module. Also keep in mind that the learning module is the course as it was run in 2016. We've made some significant changes and hopefully improvements. So having said that, let's go back to the third question. This is from Mukeshkumar Prajapati, and again he is in the chat room. There are actually 4 questions for Rudy, so we're not Dr. Mukesh, we're not going to ask you to go through all 4 questions. We're going to go right to Rudy, for him to address or give some indications on each one. Go ahead, Rudy, over to you, and then Mukesh, if you'd like to follow up, we'll have a very short time to do so before we move to the participant presentations.
Okay, thank you again for the questions. The first question is about country examples. In fact, I do not have country examples. So at the moment, the GRISP was actually created about a year ago. The concept of a transformative investment was promulgated at that time. And I think part of this course is really to gather those examples of how people are making the transformative investments that change a country. So, of course, there are individual areas that do better on things like vaccinator skill training or leadership or those kind of things. But at the moment, I can't give you specific country examples. I am hoping that from this course, in fact, you are able to come up with those examples. And if we look at the last course, maybe Reda can help us. maybe some of those people can give us feedback of how the work that they learned in the course and the implementation of their own transformative investments have indeed made a difference in their country. To question 2, how can the transformative investment be integrated with regular health system strengthening? And I would like to add to that the question 4, how it is linked to universal health coverage, SDG, etc. So, in fact, both of those questions relate to the relationship between the transformative investment and health system strengthening. If you look at it, the transformative investment, almost all are actually located in the health system strengthening arena. If you look at the capacity of the national team, that is true for the immunization program, but it's clearly true for the entire public health system. If you've got a strong national public health leadership in any program, or in fact in the government, then that is actually a transformative. Strategies to reach, of course, are not only EPI strategies, but account for all others. Strategic planning, operational funding, health worker skills, information system, community support, all of those are really building blocks of the health system on its own, as they are applied here to the immunization program. So, in fact, the transformative investments are really the existing building blocks of the health system strengthening. There are some items that are, of course, more specific for the immunization program. We talk about, of course, the vaccine supply chain. There are other supply chains of medication and of equipment that other programs have. The only added issue with vaccines is, of course, the cold chain. Keeping the vaccine cold is different to other chains, but otherwise supply chain of medication is quite similar. And then the life course approach to vaccination is, of course, also quite specific. That is, of course, located in the difference of the vaccination program as a whole. So the vaccination program is actually quite unique in the public health arena, in that it is set up to actually reach everyone. So it's actually quite different to a malaria program or a TB program or even a maternal health program that has got specific target groups that they're looking at to reach. The vaccination program is different. It reaches everyone. So certainly after birth, one hopes that every child is vaccinated. But the strategy, of course, or this transformative investment calls for the expansion of that, so that the reaching everyone goes to adolescents, goes to maternal, goes to aged, vaccination of the aged, beyond that. So I must say the transformative investments are very firmly rooted in the health system strengthening arena. And that really puts it also in line with the universal health coverage. Universal health coverage really focuses on 3 axes: access to services, the quality of services, and the affordability of services. And those are really reflected in the transformative investments as well. It's not directly translatable, but actually in essence similar. SDGs, well, the SDGs, of course, are at a very high level, and the best way to look at the SDGs, certainly for health, is to look at the indicators that are being measured, and you can see which direction that is, that the intent was of formulating those SDGs. For the immunization program, of course, the child mortality and the mortality as a whole, communicable disease mortality, is the greatest issue. So that's the second and the fourth question. The third question relates on transformative investments in resource-constrained settings. Yeah, this is always problematic. I know here from Kenya, where I'm working now, that programs that are underfunded have got a hard time actually in growing and reaching their potential. And ultimately, there's no real substitute for being resourced. So to some extent, resource mobilization is what is needed. But part of the intent of the transformative investment is to make you also think about the value, also the resource value of things like skills. So a vaccinator skill or a leadership skill is something that can be developed. It does cost money, but in many cases, it is also something that actually can be developed without a lot of money, without a lot of resources. Those skills can be transmitted from one to the other and actually contribute greatly to the program. Things like strategies to reach frequently don't need that much money. They need thoughtful analysis and innovation in reaching the unreached and the hard to reach. So it's more of a thinking process, an innovation process, than finding the resources. Back to you, Reda.
Thank you very much, Rudy. Okay, so those were the three questions. There's a fascinating, some great dialogue in the chat, and again, you are. It is not only allowed but encouraged for you to be engaging in this way. Alexandra Karik is on a shaky connection, but we're going to see if we're able to unmute, if we're able to hear her before we go to the participant presentations. Alexandra, good afternoon and welcome. You wanted to follow up on the question from Tapas Nair on the question of a hard-to-reach population. Go ahead, please.
Yes, indeed. Can you hear me?
Loud and clear.
Oh, perfect. Okay. Hello, everybody. If I understood Tapas's question correctly, I somehow sensed that he was questioning reliability and maybe comparability of the coverage surveys that are widely trusted. I wanted just to add to what Rudy said, that we have to be honest and say that no really data source is a kind of what we would consider gold standard for estimation of coverage. However, for countries that have substantial discrepancies in coverage estimates, until the data, administrative data and population estimates permit more reliable estimation, population-based surveys may be, or should be maybe even, conducted more than once each 5 years, every 5 years, to permit really triangulation of data. So I just wanted to add that one. And I saw while you were talking and while Rudy was answering also in a chat box the definition of hard to reach areas. I would just like to add there that it's not just geographically hard to reach areas, that hard to reach areas are those that are also where persons are living in civil conflict or insecurity, or the ones that are resisting vaccination with strong anti-vaccine groups. So they may be physically easy to reach, but they're hard to reach because of their opposition, or where you have urban settlers or squatters or migrant workers or near the borders. So just wanted to add that we have to keep in mind that there is more to hard to reach areas than just hello. Thank you.
Yes, you.
Okay.
Yeah, okay.
That's for me. That much for me. Thanks.
Okay. Thank you very much, Alexandra. All right. And for those of you who are listening or viewing the recording, there are many interesting messages and great dialogue in the chat. We won't be able to read. What we usually do is read the comments here. There are too many. So again, to encourage you to actually attend if you are able to, because we want to spend most of, if not all of the time remaining on the oral presentations by participants. So we are going to bring out the infamous timer. And you will have 3 minutes. So first of all, before we start the timer, you'll tell us which update you have selected, and I'll bring it up on screen. And then you will be asked to first briefly comment on the selected transformative investment and prioritized strategies. And then really what we're looking for is share your experience to provide constructive advice for what kinds of activities, with respect to one of the strategies, you would recommend or suggest to your colleague who is the author of the update. So again, we're in week 2. In week 1, we had presentations about the transformative investment and prioritized strategies. In week 2, we're asking you to practice giving feedback, because you're going to be doing a lot more of that in a very structured manner once you have submitted your creator projects. So let me bring up, let me go to the next slide, and because for reasons that participants who were here last week understand, we're going to start with Dr. Khalid Abubakar Aiza. So let me start with you, and are you able to speak? If so, welcome. Okay, Khalid, you may need to unmute yourself, because at least I'm not hearing anything. Okay. All right, so I'm going to express my...
Hello? Good afternoon, everyone.
Yes, good afternoon.
Good afternoon, everyone.
Yes, welcome.
Hello.
Good to hear your voice. We're able to... Yes, we're able to hear you loud and clear. Okay. Are you able to tell us...
Okay, sir, thank you very much. I'm hearing you well.
Great. So can you tell me what is the name of the author whose update you have selected, please? Okay, there seems to be a...
wow, I didn't actually do that.
Okay.
Hello?
Yeah, all right. So if you have not, it sounds like there's a lag in the audio connection. So let's go to Adamu Ibrahim. Adamu, welcome. Are you able to speak?
Yeah, good afternoon, everybody.
Great. Well, welcome. Good to hear your voice. I can hear you loud and clear. Can you tell us the name of the author whose update you would like to give feedback and share your experience with?
Yeah, it's Dr. Nahad from Sudan.
Okay, so Dr. Nahad.
Nahad.
Okay, yes,
yeah.
Got it. Yeah. All
yeah.
right, so let me go. You should be able to see my screen full size. If it's too small, let me know. And so he has indeed, so he is a UNICEF MENA Regional Immunization Specialist. And let's go to his update. So let me see if I can make a little more room. Yeah, how is that? Okay, so country of focus is Sudan, and here we have key strategies, and I see, Adamu, that you already gave him written feedback.
Yeah.
So I'm going to get the timer ready, and
Okay.
I'm starting the clock now. You have 3 minutes to comment on the update, and then really focus on most of your 3 minutes on giving advice, sharing your experience on how to develop activity planning for one of the strategies. Ready?
Yeah.
All right.
Well, actually, the transformative investment that is choose, that's to identify unvaccinated and vaccinated person, and regularly provide them with vaccines they need. So I think there are some peculiarities that are common between Sudan and Nigeria because of insecurity due to the war that they are doing, and then our own insurgency. So when I look at the strategies, actually I found out that there are some key ones that are missing. Because if you want to improve on under-immunized and unimmunized, actually you have to start by having a detailed micro plan, which will give you information on the areas that you'll focus. And then also you need to prioritize service. Because of the fact that they're having areas that may be insecure, actually you have to prioritize services to reach the largest number of unvaccinated. which may be particularly areas where there is insecurity. Maybe they can be inaccessible or partially accessible. Then there's also need when we identify the areas actually to go in and do periodic routine immunization intensification actually, so that we can now make sure that areas that have issues we now reach and immunize children in those areas. So looking at the plan, actually I think there is need also to have some explanation actually on the data, because he gave information on the mixed data, which seems there's no problem, but actually we are not sure of the administrative data. Is there any discrepancy? And that's one of the questions I asked him. So, so that if there are data issues also, that one can also be a factor in planning for the reaching the unvaccinated and vaccinated. Then okay, then the other issue actually is looking at resources, actually on how to come about the resources that can be utilized actually for this activity, considering the fact that actually Sudan is under embargo for some time actually, and there's no donor or partner support. Actually, how is he going to source the resource? How are they going to source the resources actually to address this issue of unvaccinated and vaccinated? Actually, these are some of the issues that we need to critically look at, and then actually to come up with a more detailed plan. Thank you very much.
Thank you very much, Adamu Ibrahim. Rudy, back to you to comment and share your insights again from the GRISP perspective, but also from your own expertise and experience with respect to the presentation and feedback we've just heard.
Yeah. Can you hear me?
Loud and clear.
Again, not much to add. I think good thoughts and good ideas here.
Actually, if you could speak louder or closer to your microphone, please. We're straining to hear you.
Okay, I'm sorry. So I think just let me pick up on the one issue, the so-called invisible children. So invisibility is a very strange thing, because there are in fact quite a number of children that are invisible by choice. So there's the reason that they are not visible to the system is because their parents or the people that are taking care of them choose to make them invisible. So not only do you have to deal with things like vaccine hesitancy, because you are concerned about the maybe the effects of the vaccine, but very frequently the invisible children are in fact invisible due to other reasons. They are not registered as citizens, or they there's a reason that they are kept invisible. So in fact, dealing with invisibility of children requires a very detailed understanding and knowledge of why these children are invisible. So in fact, it's almost impossible to find these children unless you go onto the ground, onto the area where they are, and speak to the people that are there to understand why these people are choosing to be invisible. And it requires very specific strategies to actually reach them. So I just wanted to pick up on that one point. Back to you, Lena.
Okay, thank you very much, Rudy, and thank you to Adamu Ibrahim, our second presenter. Unfortunately, for the second time, for the second week in a row, this time because of a technical issue, Khalid was not able to present. Let's now go to Alain Blaise Tatsinku. So I have unmuted you, and again, a warm welcome.
Good morning, Veda. Can you please share my screen, because I have a presentation, so I want to go quickly So, and then I have something that I can share with all the colleagues afterwards.
Great. Yes, I've just there should be a prompt now to share your screen.
I
Okay.
did.
Wonderful.
So,
I'll start the timer now.
So, good morning once again. So, I'm presenting the suggestion made to Dr. Calvin Tonga. The country focus Cameroon, the transformative investment is invest in tailored strategy that is to identify on the vaccinated, unvaccinated person. And so brief, I just have a brief to remind the objective that we were asked to do. And sorry. And the importance of I start with a small definition to remind everyone for the importance of micro-planification in management of health project or intervention in general or organization. So you will see now how important it is to better plan, implement, monitor, and finally evaluate activities and resources for the project. So a good planning will ensure a better rationalization of services offered, resources, and mainly will make sure that the donor and the partner are really seeing clearly how the resources are mobilized and used. And that is really important. So my suggestion was to Calvin, which is something more general. I'm talking about suggestions for microplan in general, not specifically what he done. It's like we have first to develop tools for microplan. Develop template, Excel-based template from my experience is better because after a while you have to aggregate everything. You have to organize meeting at national level, at all the level of the system to present your tools. You have to develop training material for each level of your system. You have to conduct training among Ministry of Health staff, NGOs, partner, community. You have to make trainings. You have to test your template afterward by sampling some district. And then you constitute a pool of multidisciplinary support team that will have the responsibility of conduct the session of microplanning at all the level, at the district level. And you train those staff as well. You use special strategy. You identify special strategy for area, look at, like, for example, if you take the Cameroon example, it will be the border with Nigeria, Chad, and Central African Republic. You initiate then the microplan per district. Really important, with the support of all the API national staff and the support partner, everybody together involved with one district supporting the district to draw the microplan. And eventually we involve the representative of each community, of the catchment area, the health facility staff, the NGOs, the representative of the other sector. If you can, that would be good. And then you initiate some cross-border activity during your micro-planification, because those local people will tell you exactly how to reach those people. And then so that you set up some strategy at that time for the migrant. And then mainly you use GPS to localize those people, and then so that you're able to take the point and then have something digitalized. And you allocate resources as we always do. Then finally, you aggregate your final microplan per district, province, regional, and national. I'm taking the example of Cameroon. And then after that, you have the feedback, the meeting for the feedback. And then after the feedback, when everybody's okay with the microplan, so you can now put them in digital form. So my experience for doing that, I was involved, like I said, in Cote d'Ivoire in 2006, 2017. We use that approach.
Please conclude, Doctor, because you are out of time.
Oh, sorry. So we did it in Africa. We did it in Haiti with cross-border activity, and later it was in Lak-Chad region for polio response, and it was very, very a good experience. So that's what I want to share with our colleague.
Great, thank you. Over to Rudy for feedback and comments, and I'm going to show the update we're talking about. I've shared the link, so let me just, yeah, you should now be able to see the update in case you haven't seen it. So this is Calvin Tonga's update, and thank you, Alain Blaise Tatsinku, for your feedback. And I see, there are many interesting comments also on the previous, on our first presenter. So again, maybe what we'll do is share the chat transcript for people who are viewing the recording, but really the best way is to ensure that you are present. Rudy, over to you. What is your feedback, advice, suggestions, and to this review of an update?
Again, nothing much to add. I think it was well done. Thank you very much. The one component about microplanning that we may be not highlighting enough is its iterative nature. So microplanning is really not something that you do in a once-off manner, but is something that you repeatedly do for each. Certainly for the routine program, we know microplanning for campaigns, of course, are done prior to each campaign. But really, the microplanning that we're talking about here for the routine program is something that is an iterative activity that is supposed to be sort of learning from the previous microplan, the implementation thereof, etc. So that's maybe something that I would highlight more is the learning approach from taking the microplan, implementing it, reviewing how you did, and then doing the next microplan. Back to you, Rita.
Great, thank you, Rudy. So let's go to our next presenter. Let's try to squeeze one more presentation in, and so after Alain Blaise Tatsinku, we have Friday in Coma. And let me unmute, let me see, Friday, okay, yes. Good afternoon, Friday. Welcome, are you able to speak? Can you hear me clearly? Okay, at least I'm not able to hear Friday at all, so I'm going to leave the microphone open for a couple more seconds. Let's go to Mohamed Miroz Salem. Okay. And again, we only have a few minutes left, so we do have many more questions to go back to. So maybe we'll go back to questions or ask our course team member subject matter experts to conclude. Yes, Mohamed Miroz Salim, are you able to speak to us?
Yeah, hello.
Okay, yes, welcome. All right,
yeah,
let's...
can you hear me, please?
Yeah, yes, loud and clear. So could you give me the name of the person whose update you'd like to share your experience about?
It's Pragat. Yeah, it's
Sorry,
Pragat from India.
Okay, yeah. So that's
Pragat.
Yes. All right, let me share then my browser so we can see the updates. And we are going, this is going to make us go over time. So again, if you are able to, if you need to go in 2 minutes, you of course are free to go. But for those of you who are able to stay on, this will help give hopefully useful advice. So let me see, here is the update so I do not make the mistake I made with Calvin's. So yes, so
really here, I do need to excuse myself. I do have another conference to go to. So just to appreciate that you called me into this meeting and to encourage everybody to continue working on this. The routine program is a great program, and good luck everybody. But I need to excuse myself now.
Great.
Thank you.
Okay, thank you. Thank you, Rudy. All right, we'll take one last presentation, and then I will be staying over to walk through the steps related to getting started with your creator project and explaining exactly how that works step by step. So if you need to go, as is the case for Rudy and perhaps Alexandra or Jamil, of course you may do so. But for those of us who remain, Dr. Mohammed, the floor is yours. I'm starting the timer now.
Thank you very much. Regarding Pragat, he chose to invest in vaccinators and district managers, be regularly and systematically building their capacity. Regarding the strategies, what he have already done in transformative investment, number one is ensure ongoing refresher and in-service training to the vaccinators and supervisors. And then he explained a few things which they already done in India. My suggestion is that instead of going for haphazard trainings, then they have to be very much clear that how frequent the training should be. It's like quarterly mid-level managers training for the mid-level managers, and then at least 6 monthly training for the vaccinator staff. Then the second point, can you please go up, sir, up one? Hello.
Uh-oh.
Yeah. Regarding the promote of staff motivation, it should be like not only the reward thing or just only the regular payment material things. It should be like accountability, strengthening of accountability framework. Like in Pakistan, there is a NEEP, National Emergency Action Plan, for polio campaigns, and we are augmenting this in routine immunization as well. Reward and punishment should be like the same manner. Accountability framework at through the provincial task teams, accountability task teams, and as well as at the district level task teams. They have to be very much clear that those who are very good performers, they should be rewarded. Like in Pakistan and Punjab, we started in few districts that those vaccinators who are very much doing very much good in routine immunization, then one extra salary they have given. So this kind of motivation to not only for vaccinators or the frontline workers, but also for mid-level managers as well. Then track capacity building and ongoing training needs. That is basically what he meant to say, need-based training or need-based assessment. It should be on monthly or at least quarterly review meeting of mid-level managers, and with also the shuffling between the districts. That will be a good thing. Thank you.
Okay, thank you very much. I'm sorry about the timing for the session. We're now over time, and it would have been nice to get some closing comments from Rudy Eggers, but thank you to the presenters. Again, I hope you are not frustrated if you did not get to present today. There are some very good very good comments in the chat also, which I have not been able to read due to lack of time. We'll continue to work on improving this process. Let me turn now to Jilmil just for a final word of encouragement and guidance for the group before we go to the technical support session. Jilmil, you'll need to unmute yourself, and I hope that we are able to hear. Yes.
Hello, everybody. Can you hear me? I hope you can. Thank you very much for yet another very interactive session, and very pleased with all the comments that you've been sending and your engagement with the whole training course. It makes me want to also invite other experts to the subsequent sessions, because I see that there's a great value and a lot of good interaction, and it's learning for us as well. Here the team at WHO is also learning a lot from your interactions. So please keep up the good work, and later maybe we need to talk about who we can invite in the coming sessions. Thank you very much, and have a very productive week.
Great, thank you, Jilmil. Thank you also to Alexandra. And as you've seen through the videos and also the messages we shared with you, there's a lot of interest and a lot of support from for the work that you are doing, and I hope that this will, some of you certainly do not need additional encouragement, but it is there. All right, so let's now bring this session, the formal session, the mandatory session that is a certificate requirement, is now finished. However, I am staying online in order to show you step by step what you are going to be doing, how this whole business with Creator works in this for your course project, how to get started. Again, we do have videos that show you exactly what I am going to show you. However, we find that for some people, and you may be amongst them, it's easier to actually listen and watch to me knowing that I'm there rather than watch a video on your own time. Whichever way works, we do both. And if you want, if I go too quickly, you can of course put in the type in your comments or questions. I'll be keeping an eye on the chat. Conversely, if you just want to watch the videos afterwards, that is fine. So let me start by logging into an account. And you should be able to share my screen. So let me see. So, and I'm looking for, yeah. So this is not my administrator account, but this is an account for a course participant, just like you. So let me sign in and let's see what happens once I'm in. Now, as you recall, the first thing you see is your personal profile. And in fact, to go to the course community, you want to actually click on WHO immunization strategies. And now you can see all of the things that are happening in the community. Again, I'll show you quickly before we dive into Creator, and you can see I have some notifications up here. And this is where the action is to start your Creator project. There is a Creator button here, but you don't need to actually click on it. It's best to go to notifications because that will help you start and ensure that the project starts. You start your Creator project in the good way, in the right way. And again, in Scholar, there are some things where if you don't follow the steps, if you don't follow the instructions, you can quickly get caught up and end up with a project that you may have worked very hard on, but that is not connected to the course, and that will not be considered by the course team as an assignment that's been submitted, or with a Creator project, which is the main project in the course, as eligible for peer review. So so you're going to need to carefully follow the steps, otherwise you may trip up and find yourself disconnected from the course. So not removed, as I've said in some of the scary messages I've sent as reminders, to try to motivate and sort of so jump scare some folks into action. Many of you, especially those of you who are attending the weekly discussion group, do not need these kinds of reminders. So I apologize if they seem a bit harsh or uncouth. But the bottom line is we want you to succeed, and for some people, that kind of messaging works. So anyway, you know how to find the updates, right? You go to update from the course team, you go to updates, then you filter updates, and then you go to admins, and that gives you all of the updates from the course team. So of course, the one we're interested in is to start your Creator project, right? Now, just before I do that, let me just show you what else you've got in the updates from the course team. You've got congratulations, you made it through week 1. And again, we don't post messages just to post a message. If we do, it's because there's action needed on your part to actually do something, or because we have something important and relevant to communicate with you. So in here, you can see there's the catch-up guide. Then there is the request for feedback. So yes, we shared that again today. Again, there should be at least as many people completing this feedback, and there will be one every week. It should take you no more than 2 minutes, but really, really valuable to hear directly from you. If you have not watched the message from Alexander Karik, please do so, as well as from Dr. Madhava Ram Balakrishnan. These are messages recorded by Alexandra, of course, is a member of the course team. You've seen her in the discussion groups. She is on hand to support you toward progress and success. Madhava Ram Balakrishnan will be contributing examples and country-specific case studies that may be relevant to your work. And then here again, please complete the feedback questionnaire. So we very much appreciate your comments and feedback. Let us know. You have ways to communicate anonymously if you're not comfortable giving candid feedback, especially if it's negative. But we appreciate all feedback is good feedback. So that's what this update was about, and that was really closing off week 1. Okay. Now, what you should be paying attention to as well here is the week 2 community assignment. So week 2, what is the week 2 community assignment? Many of you have, in fact, jumped the gun, but in a good way. You've started to do this spontaneously without needing to be prompted by the course team. That's, again, very commendable. We want you to, for your week 2 assignment, comment on 3 updates of your colleagues. Yes, we suggest you do one comment a day, but you're free to organize yourself however you want. And some of you, and you've all been very good at doing so, figuring out exactly how to make time for the coursework to complete your tasks. And again, Akachi, if you need to go, that's fine. We're over the time. This is really for people who would like the walkthrough and the extra technical support. So now, here's another magic link, and this one is different. Remember, there's a link that will allow you to view only updates from the course team. So this is the opposite. This will show you the updates from course participants, so from all of the people in the course, and this is how you can get a quick overview of all of the countries of focus and transformative investments and strategies that have been posted by your colleagues. And of course, there's a lot that you are able to gain from if you put time into reading them. What's required is that you read at least 3 of them that seem to appeal to you. And again, we'd like you to share your experience of a strategy that you have practiced, for which you have developed activities. So this is not about just giving your opinion or making a judgment or evaluating your peer, a fellow colleague. This is about giving them something constructive that they can use, that can help them figure out how to implement the strategy that they have prioritized. And again, the important part is the explanation you give on what basis are you suggesting these activities. Okay, so that's the main, those are the 2 main updates in addition to the GRISP lectures that many of you have seen as well. So now down to the main feast, which is to start your creator project. So we actually sent this out on a Saturday. So some of you are already forging ahead, but I'd like to show you how it works. First of all, you do have the videos. The first one is on starting your activity plan. The second one is a guided tour of the creator space where you'll be developing your work. There is, if you're unable to view the videos streaming in YouTube, there is a Dropbox folder where you can find the videos and download them there. One of the key tasks is setting up your activity plan structure. So we'll go into how to do that. And then, there are some sort of ground rules on how you write in Creator. If you're used to Microsoft Word, it is significantly different from Microsoft Word in the sense that it is very simple and basic. There is no room for making things big and bold or making a purple headline or just think of it as a very basic bare bones text editor. And if you are developing your work in Word, keep that in mind. Do not use any fancy formatting. Preferably do not use any formatting at all, and then you'll have no problem copying and pasting into Creator. Creating your activity tables, we have a specific tutorial for that. It is again different from what we are used to in Microsoft Word, but there is a reason and a purpose for why it's different. It's that Creator is what's called a semantic text editor, so we'll be it'll enable your colleagues to peer review your work, and it'll enable your colleagues to make sure that there's consistency in how these different projects are presented. All right, so now you can see that I received a notification up here. I actually have 2. I'm not sure what the other one is, but I'm connected to several to several courses. So the one we're interested in is this one. So this is, you have received a work request And of course, it's the GRISP Transformative Investment Activity Planning. And here you have two buttons, start a new work or use a work you have already started. So could someone tell me in the chat which one is the correct one to press, please? Should I click on start a new work or use a work you have already started? Okay, thank you, Oluwatosin Kuti. Yes, thank you, Pranit. Yes, that's correct. So the first time you receive the notification, you'll see start a new work. Don't click on use a work you have already started. If you've already started something in Creator, you won't be able to use it. Let me just tell you that outright. So don't try to do it. We'll just get in touch with you and ask you to copy and paste over using the start a new work option. All right, so let's see what happens when I start a new work. So I've clicked on the button. And you can see this takes a few seconds. And all of a sudden, I've dropped into Creator. But this time, you can see that there is a title here, Country of Focus, Add Yours, Transformative Investment, and then something else with an ellipsis here. You can see here that there's a description of what I am to do in the project. Okay? To justify my choice of transformative investment, summarize how and why I've prioritized 3 strategies in line with this TI. And let me just... And then develop and describe at least 3 activities for each of the strategies. So that'll be 9 activities in all, at least. And summarize how I'm going to do the M&E. So you may use, and so this is a kind of shortcut, the work you did in week 1 is going to be useful to you because it could be the basis for your Creator project. So that is where you start. Any questions so far about accepting the notifications and starting new work? Okay. So now, what is your first step? First of all, you're going to want to change this title to reflect the country that you're using and go from there. So Mohammed asks, I've already done this, what is next? All right, well, we'll get to it. We've got another 13 minutes to go. I know that some of you may find this is good, that I'm going too slow. Others of you I know are going to contact me and ask for additional support. And either way, yes, we ask for your patience. If you think I'm going too slow, I'm going to try to be comprehensive. So here you can see there are many options, project info structure, and each of these little menus has, like project has 4 sub-menus. So that's a lot of places to where you can possibly go, and it's easy to get lost in Creator. So in the video tutorials, and now I'm going to show you just the things you need to do and just the places you need to go. So I'm not going to try to explain everything in Creator. Creator is a very powerful, extremely powerful tool. So you need to change, what do you want to get done? You need to change the title of your piece, and you need to set up the structure. So I'm going to go to project description, and yeah, actually, so under about this work, in info and work. So this is information about the work. The work is the course project, the action plan for transformative investment. So answer to Pranit, yes, you can change your transformative investment from what you posted in the week 1 update. You're not bound by that. So as I go into info, you can see here work icon, work type. I actually just want to change the title. So as I hover my mouse over this, I can see there's a little yellow pencil. I hope you can see it on your screen as I'm sharing mine. And so click on the yellow pencil, and this opens up. If you don't see a yellow pencil, the most common reason is there are some obscure but nasty bugs for people using Internet Explorer or Microsoft Edge. So these are the default browsers if you use Windows, and they tend to cause lots of problems. One of them is that you may not see the little yellow pencil and therefore might not be able to change the title. The other thing is if you are using Google Chrome and you are automatically translating the interface into something other than English, these, you may not see the yellow pencil and you may not be able to change the title. In this case, I am able to change the title, so let me just grab, just to use an example, this would be Republic of Maldives and Strategies to Reach, okay? Let me see if Nashia is here. Yes, all right, so I was just looking at the Excel sheet where we keep track of these, and you, of course, will put your country of focus and your transformative investment, but again, do use the short title for the investments, not the very long sentences that many of you put into your titles. Once I've done that, I put save. Okay, was that, any questions about that step? So again, this was in info, work, title. And I click on the little yellow pencil. All right. So now you can see that up here, it now says Republic of Maldives, Strategies to Reach. Okay, so that step, that's an important step. It's covered by a video tutorial. So if you need a refresher, go ahead and look at that, please. Now, I'm actually going to need a refresher myself as to the structure of the project. So let me just pull this up here. Okay. So we need justification, prioritization, activity planning, monitoring, and evaluation. So here I am now in about this work, but this time I'm looking at structure. And this is the most fundamental difference between Creator and Microsoft Word. In Microsoft Word, you show that a document has structure by creating headings. You might make the headings bigger, you might give them a color or make them bold. You have none of those options in Creator. On the other hand, you have an even more powerful one, which is to describe the structure of your project. So in this case, again, we want to start with the justification. So right now you only have one element of structure called untitled element, and you're going to click on the little yellow pencil. This is not the same. We're not looking at the project title. We're looking at structure, so that's something different, and type justification. And if you, so that you don't have to type that, and so that it appears as a big bold heading, you should display heading in view and output. Now you have many options here. You just leave the default option to section and save. All right. Next, your second section is going to be prioritization. So here again, a section, again, you display the heading and the output. Then you're going to have activity planning and save here. And finally, you're going to have monitoring and evaluation. So I'll just put monitoring and save. Okay. So you might say, what's the point of doing this? Why create these four elements of structure? So this is my justification. So my transformative investment is, let's say, Strategies to Reach, the most popular one. Okay, now watch what happens when I click with my mouse on prioritization. I go to another element of structure. What just happened? My text that I had typed in, my work is gone. What is going on? Now, this will be the first time, but I'm going to repeat it many times. You do not need to click on save as long as your bandwidth is decent. You do not need to click on save as a new version. And most of all, you do not click on submit for review. So what happened? Did Scholar lose my text? The answer is no. Each time you click on an element of structure, think of it as like a different bucket or a different box that you pull out, and in that box is the text that you put into it. So for example, so I click on justification again, and the text I wrote up for justification is back. If I click here, here is why I prioritized these three strategies. And of course, I would, write significantly, substantively more than that. Now, if I go to activity planning, where is prioritization? Where is justification? I think you get the point by now. So I'll repeat it now. You do not submit for review until your project is ready for peer review, which means you've completed all these parts and you're happy with the draft and it's ready for others to begin to look at it. You don't need to save. Scholar saves automatically, Yosa, as you work, and you do not need to save as a new version. If you save as a new version, that will make it that will make us think that you're not making significant changes. And if you save when you don't need to, basically ignore these buttons and these options at the bottom. Okay, I hope that's clear so far. Any questions? Any comments or questions for people who've already gotten into Creator? All right, so here is, in this space, this is your space for writing. So it's got, just like Microsoft Word's toolbar, but with more limited options. There is no way to, in principle, to make something bold. So you see there's no bold option. The best you have, the only option you have is emphasis. You can make numbered and bulleted lists. You can use block quotes. You do have this subscript and superscript and footnotes. Here you have the table editor. And maybe that's the last thing I'll show you. Here are some math options and special characters. Here is where you make a link. You can add images. You can insert a video, audio. You can insert an attachment, say an Excel sheet, for example. But we only do that if there's no way for you to do what you want in Creator. Now, if you have something you'd like to paste in, say some complex table, you may choose to take a screenshot of it on your computer and then insert that screenshot into the Creator project. Okay, if you have a YouTube video that demonstrates something about the program, and if you've been looking at the analytics, you'll see that we actually consider that the more multimedia elements you use, even though this is a formal context, the stronger your project is likely to be. So that is a factor to consider, to be using images, videos, sounds, attachments, embeds from YouTube. So now I just need a reminder myself of what the tables look like. So activity 1, activity details, stakeholders. All right, so let me show you. So for the strategies, or for the activity planning, so I will have my strategy 1, and for each one, I'm going to make a table that has 1, 2, 3, 4 by 4. Okay, I'm going to insert a table here. So I want 4 rows, 4 columns. For width, I can type 100%. For height, I leave that blank. Headers are just the first row. Let me see if that's the case. Yeah. And that's basically all I need to put in. So as soon as I click OK, this is a lot like Microsoft Word, just the options are different. And I can tell you it's a bit more tedious to use, especially if you're used to things working a certain way in Word. And to answer Emmanuel's question, there are no options for colors. The only way you can sort of add color to your piece is by inserting images. And we have seen people do amazing things with Creator. So let me see what, so activity 1, activity, yeah. So I'll type in here, then I have to click in activity, whoops, details. Then, whoops, yeah, I can't actually see what that is supposed to look like. Let me just go look, give me a second to go look up the example project, which I think was in the pre-course or in week 1. So I'm just looking in the learner resources folder. So sample activity plan, okay, that's what I need. Yeah, so that second column is actually stakeholders, and that third column is integration. So how is this activity going to be integrated into the overall immunization activity? So here we have, once you've created this table, you've seen, yes, you basically need to do that 3 times, 1 for each one of your strategy. And there is no way you can just copy one table and duplicate. You have to create each one individually. And yes, the sizes of the columns are going to be defined by Creator. All right, for Nashia, who's made the mistake of hitting the save button, so you save is the one that's not as bad as the others. The real problem is people who click on submit for review or save as a new version. So you're fine. You can see here that Creator tells you when was the last time it saved. So in a few cases, I've been working in countries with limited bandwidth, and in some cases when I don't have enough bandwidth, when I have a slow connection, then I have seen Creator fall behind, and in some cases, yes, that is the only time when you should be clicking the save button. All right. So let me go through the process again to insert a table. So here we have the table button in the toolbar. So I click on that. 4 rows, 4 columns, 100% width, and headers are just the first row. All right. So activity 1. Then I click here, activity details, stakeholders, integration. And again, if you need a refresher, 1 is the recording of this session is going to be posted online, and 2, you have video tutorials that show you all these steps in the update. So can rows or columns be added later? Yes, as you can see here, you can insert a table before, insert a table after, so you do have some options, and you can also edit the overall table properties once it's inserted. What you cannot do, I believe, some of you may find a way to do it and prove me wrong, but I think, yeah, if I try to copy and paste, this is what I get. So let me see if there's another way to copy and paste there. Let's see if, no. So you do have to create create 3 tables. There's no way to copy 1 table and duplicate or paste it again. Okay, but as you can see, it may take you, it is likely to take you longer than it took me, but as long as you follow the steps and you can really sort of step through the video tutorial, look at one step, do exactly what you just saw, and repeat, and keep doing that until you've got your 3 tables done. Once your 3 tables are in place, you just start filling them in. Yes, so activity 1 is training. What are the details of the activity? And now, one of the things we saw is in a 2016 course is that because we suggested using a table to sort of simplify and make things clear and to the point, some people only put a couple of words in the activity details, and they tended to use the most common, prevalent activity that they're most familiar with, the most conventional one. And we are going to be actively encouraging you to consider activities that are new, that are innovative, that are potentially transformative because they're new and innovative, as well as the tried and true activities that you are already familiar with. So that's the table creation. We're now again over time, but we were over time for the mandatory part of the discussion group. So if there are any, yeah, the integration columns. So yes, it should be a yes or no. Maybe I can turn to Jill Mill for some advice on how to build a compelling activity planning table. Jill Mill, are you able to hear me? And if so, we've got a question for you. All right. Okay, so yes, you should, basically think about your purpose is to convince your colleagues in your Ministry of Health to move on these strategies and to do it. So the more compelling you make the activities and the more realistic and feasible, the better. Yes. So what happens if you press the button submit for review? Creator will blow up. No, I'm just kidding. Creator will not blow up, but your work will move into peer review. Now, if you do this before the deadline, you will be able to unsubmit. But it means the course team receives a notification. We say, okay, great, someone has actually finished their project. It's ready for peer review. So we may look at it. And we don't want, and if you're halfway through your draft and you've press that, then that's not a good use of your time or of ours. So we ask that you don't click on submit for review until you're actually ready to do so. So if you've pressed the button, your work goes into here. You can see the project status. So right now your draft is pending, and as soon as you push submit for review, it will say review pending, which means it's being pushed out for peer review. Now it won't be pushed to peer review until we reach the deadline. So you should be able to unsubmit if we're before the deadline, but your draft is due on November 4th at 11 a.m. So as long as you do it before November 4th at 11 a.m., the exact time will be different, of course, depending on your time zone, you'll be able to unsubmit. But we ask that you just don't touch that button. It's that simple until you're actually done with your draft and it's ready for peer review. I hope that is clear for everyone. And one more thing, because this group is so far ahead, you'll be able to discover that the rubric, so what's supposed to be in your project, as you know, there is something called the rubric, which are the criteria together with ratings that define what should be in a project. So here you have all of the criteria. The entire rubric is available in the right-hand side here. So you can and should read this. Of course, you also have it as a convenient PDF download in the shares. This is the assignment. This is what you have to do. These are the instructions and the guidance for what you have to do. And you're using them as authors now. You will use the same rubric when we move to peer review and you're looking at the work of others. And to give you a sneak preview, again, this is all under the feedback pane. You'll be assigning ratings, deciding whether for monitoring and evaluation, for example, the person you're reviewing deserves a 4. And what is a 4? A 4 is a relevant, useful, and specific summary of monitoring, surveillance, and evaluation. Or if there's no description of monitoring or evaluation, then that should be a 0. Whatever the rating you'll give, this is really looking ahead to week 5 of the course, weeks 4 and 5 of the course. You have to explain it, and that's the important part. Just tell us why this is a 0, why this is a 4, or something in between. So right now you can just look at this for reference as you're developing your project. You have the PDF that includes exactly the same information, but you can also look at it here. So it can be handy as you're thinking about it to look to the right-hand side in Creator. So I hope that's useful. I know that many of you, several of you, have already jumped in and started developing your Creator project. So if you have not, do not delay to get started. We really need to get to get going. Yes. So if you press the submit and review button, there will now be an unsubmit button. So press that. Otherwise, you risk putting your work into peer review before you're truly ready to do it. All right. So we're now considerably over time. I look forward to answering your questions via the WhatsApp group or in Scholar. We do have updates specifically with these video tutorials. Again, I walked through them in the beginning of the presentation. Let me just start your Creator project. That one has all of the video tutorials. This has the feedback survey, the community assignment. What you need to get done by the end of this week is right here. That's what we've got so far. And of course, the rubric has been available in the shares since the first week of the course. This is the GRISP activity plan rubric. So if you let me just see if I can put this in. Yeah. So this is the activity plan rubric. And if you haven't looked at this, take your time to read it. This is what you're going to be doing for the next 5 weeks. So this explains what should be in the plan, and of course the other resource alongside with the rubric will be the GRISP guidelines themselves. So thank you very much for your attention. I hope this kind of tutorial is helpful. Look forward to seeing your work, and we will be looking. So your colleagues, your creator space is private. That's why it's different from a community where everything is shared. What you do in Creator is your work. So you own it. Other colleagues will not be able to look at it until peer review, and then they will do so anonymously. The course team, on the other hand, we will be looking at what you're doing in Creator, and we will be giving you feedback. So do look out for messages and notifications that that point you to what's called dialogue. And again, this dialogue is private, so only you and the course team are party to it. So we hope to be able to have those individual exchanges, and you can also use dialogue to ask us questions, even though there we encourage the use of first the Scholar community, and if you're really in a pinch, you can reach out to us on WhatsApp. Great, look forward to wishing you a good, productive week. Don't fall behind, don't wait another week before you start digging into Creator and actually going through some of these steps yourselves. Many of you are incredibly busy, we know that. But if you focus on this, we're stretching out. Most of you can probably do something like this in a few hours. We're suggesting that rather than wait until the last minute and try to do that, you take time out, set aside a little bit of time every day, or however you're most comfortable working, and we believe that is how you are most likely to succeed in the course. So good luck. Wishing you a productive week, wishing you that your other work is also proceeding along well, and wonderful getting to know you. And I'm now going to unmute everyone so we can say goodbye and see you in Scholar. Bye-bye.
Bye, Reda. Thank you so much.